MS, Dr. Kishore Kushale, other heads of departments, chairpersons, teachers, colleagues and students. Year after year, I have been sitting on the other side, listening to Kurulkar oration. I never thought at that time, even I usually have a lot of mental, what do you say, run around, but I never thought I would be actually delivering a Kurulkar oration. Madam spoke about disability. When you get a disability, you have to start thinking in the other way around. Like 1 in 800 people suffer from this disorder. So because I have suffered, I have spared 799 people in the world. Mathematics was always and is always my passion. So then people say, then why did you join anatomy? Then the medical field was because you have to learn something which you already do not know. Mathematics is okay. Then I thought, when I studied various subjects, I found out that anatomy is closest to mathematics amongst all the fields. People say there is more mathematics in PSM. I said that is arithmetic and statistics. The entire mathematics encompasses much more than what is there. Physics almost entirely is based on mathematics. So vectors, muscle movements, muscle action was what I found, and students find it most difficult. They try to by heart the actions of different muscles. I thought, why don't we put it in vectors? PCB, PCM, there are some students out here who do not like mathematics. Probably will find this a little too difficult. But otherwise, those who are even remotely inclined towards listening to vectors will definitely benefit from this particular talk. So that is the topic which I plan to do. There are some five concepts which we are going to discuss today. Muscles act best. Now, muscles act at joints only if they cross them. The underlined words are what we are going to discuss further. Strength of a muscle is directly proportional to its cross-sectional area. Pinnate muscle lose their potency because of the oblique line of pull. Does it lose? If it loses, how much does it lose? Muscle act best if they are at right angles to pull-off movement. And line of muscle pull and axis around which the movement takes place should be skew. That is non-intersecting and non-parallel. So these are the 5 points which I want to cover in this particular. Muscles act best and act at joints only if they cross them. Here the they stands for muscles, them stands for joints. So what do we mean by muscle? Muscle is the fleshy belly which is somewhat brown in color, which you all know. But here I am referring to the contractile part as well as the non-contractile part, tendons, aponeurosis, ligaments, etc. So when we say quadriceps is inserted onto patella, in reality, quadriceps is inserted on tibia. Patella is just a sesamoid bone form. So ligamentum patellae is considered as a muscle here as an extension of quadriceps. But we do not include those vestigial ligaments like we say adductor magnus is inserted on adductor tubercle and it continues as a tibial collateral ligament to get inserted on tibia. Here, tibial collateral ligament is not considered as a part of the muscle. So that is the difference. Why certain ligaments are counted, some ligaments are not counted. So sesamoid bones should be discounted and whatever is the extension should be considered as muscle itself. Muscles act at joints. What do we mean by action? Muscles play different roles when it comes to movements. They are prime movers, they are synergists, they are antagonists, they are fixators, they act paradoxically and all those things. When we use the word action, it refers to the movement produced by a muscle at a joint if no other forces, gravity, inertia, external forces, other muscles interfere. That is the prime moving action is called as the action of the muscle. In reality, many other factors come into play. So the role of muscles are different. Action of muscle is what we are referring to. Muscles act at joints. At joints or off joints. We say flex your knee. When you flex your knee, the leg moves behind. It's a flexion of the leg and the knee joint. The joint is always at and region is always off. So, but again, when you are squatting down, you are flexing the knee, but here the leg is fixed and thigh is moving. So it's a flexion of the thigh at the knee joint. That's called reversal of origin insertion. So off keeps changing, but the joint remains fixed. So you should always use movement at the joint. Teachers have the liberty of speaking either at or off, and you have to understand what they are referring to. So if you are asked, what are the movements? Show me movements of the knee joint. You say, sir, it's not off, it is at. Don't try to argue with examiners. Remember two rules of examination. Rule number 1, examiner is always correct. Rule 2, in the event of his being wrong, refer to rule 1. Muscles act at joints only if they cross them. We thought we knew about joints. It's very straightforward. Some interface, disconnection of two bones. There's some concept called as structural joints. Structural synovial joints are those which are limited by a capsule. Why is it important? Disease conditions of one joint is restricted by the capsule. So surgical conditions, clinical conditions, you need to study structural joints. But when it comes to movements, you have to go in importance of functional joints for movements in muscle crossing. So when we speak about joints below the talus, there is a joint, the posterior part of talus and calcaneum, that's called as posterior talocalcaneal joint. It has got its own joint capsule. Then there is a joint, anterior part of calcaneum, including navicular, forming the talocalcaneo-navicular joint. And then the third joint between calcaneum and cuboid, calcaneo-cuboid joints. These are three structural joints, posterior talocalcaneal, talocalcaneo-navicular, and calcaneo-cuboid. But functionally, these are only two joints. The talonavicular part and calcaneo-cuboid part together is transverse tarsal joints, and joint between talus and calcaneum, both posterior and anterior, together are called as clinically the subtalar joint. Orthopedicians will call both of them as subtalar. So transverse tarsal and subtalar. If you realize the difference between the movement of inversion, eversion, transverse tarsal joints initiate the movements. Subtalar continue the movements. Which is why the 5 muscles which are designed for inversion eversion, tibialis anterior posterior, fibularis longus brevis tertius, they all cross the transverse thoracic. But the movement has to be initiated there. And then it will be taken over in the subtalar joint. That's about the functional joint. In the upper limb also, radius and ulna, two forearm bones, have a joint with each other. At the superior end, there is a synovial joint. At the inferior end, there is a synovial joint. Superior radioulnar and inferior radioulnar. Remember, both these joints are to be considered as functionally one joint. You can't pronate the superior radioulnar joint while simultaneously supinating the inferior. So they always act together. Similarly, the joint between the mandible and the side of the skull, temporal. Temporomandibular joints are structurally two. One on left side, one on right side. But functionally one. You can't open the mouth from one side while closing the other half. So that is to be considered. When you are talking about movements, you have to consider functional joints. Placement of the word only is critical. Muscles act at joints only if they cross them. It's a wrong conclusion if you say if a muscle crosses a joint, it will act on the joint. It's not necessary. But the corollary, if a muscle does not cross a joint, it will not act on the joint is a correct conclusion. So don't think if a muscle has crossed, it must act on the joint. But if it has to act on the joint, and here you are talking about in a functional sense, if it has to act on a joint, it has to cross it. The meaning of the word cross, I thought this is quite obvious. When you say a dog crosses a road, you start from one end of the road, which is the other end. It's not so simple when it comes to crossing the joint. There are questions exclusively for students. Semitendinosus at hip joint, knee joint. Does semitendinosus cross the hip joint? Does it cross the knee joint? We'll start. Remember, semitendinosus refers to the ischial tuberosity, which is at a lower level than the hip joint. And it runs downwards to go to the tibia. So does it really cross the hip joint? Does it cross the knee joint? It obviously crosses the knee joint. It's not that obvious what is crossing the hip joint. Popliteus crosses the knee joint. Appears pretty straightforward. What is the action of popliteus at knee? Unlocking. If you say that it's a flexor of the knee joint, it is incorrect. It is inside the joint. Popliteus can as much flex the knee joint as you can sit inside a car and push the car. So just because it has crossed, it need not have an action. Tibialis posterior at ankle joint. Tibialis posterior crosses behind the medial malleolus at the ankle joint. Very obvious that it crosses it. What is the action of tibialis posterior at the ankle joint? Ankle joint. Inversion and eversion are a transverse tarsal and subtalar joint. What is the action of tibialis posterior at the ankle joint? Dorsal or plantar? Tibialis posterior is a plantar flexor at the ankle joint only in a cadaver. Okay? Tibialis posterior is supplied by spinal segment L4. L4, which is the site for inversion. Plantar flexion at ankle is done by gastrocnemius soleus and dentocalcaneus, which is supplied by root value S1, S2. L4, S1, S2. L4 cannot plantar flex. As I said, muscle has crossed the joint. It need not act on the joint. So in a living person, tibialis posterior has no role to play when it comes to plantar flexion. Because supplied with the wrong segment. Soleus at subtalar joint. Does soleus cross the subtalar? Starting from tibia fibula is inserted on calcaneum. So obviously on the way it has crossed the ankle joint, then it also crossed the subtalar joint. Can it invert or evert at subtalar joint? It cannot invert or evert at subtalar joint because initiation has to occur at the transverse. Okay, suppose the initiation has started at transverse tarsal of inversion. Can subtalar continue the inversion? The answer is yes, but again in a cadaver only, because inversion is spinal segment L4, lateral flexion is, soleus is supplied by S1, S2. So these are some of the things which you must remember. If a muscle crosses a joint, it need not act in the joint. Hamstring part of adductor magnus, does it cross the knee joint? We said we are not going to include the tibial collateral ligament. So hamstring part of adductor magnus or the adductor part do not cross knee joint. Vastus intermedius at knee joint. We are going to consider ligamentum patellae as a continuation. So functional knee joint is the joint between femur and tibia only. Psoas major at sacroiliac joint. You are starting psoas major at the lumbar vertebrae and from there it is inserted on femur. To understand the meaning of the word cross, you must establish a bony continuity from lumbar vertebrae to femur. Lumbar vertebrae, lumbosacral joint, sacrum, sacroiliac joint, ilium, hip bone to femur. So it has crossed interlumbar joints, lumbosacral joint, sacroiliac joint, and hip joint. This was about lower limb, which you have already dissected. Now we will take some examples of upper limb, which you have not yet dissected, but at least you have learnt in your 12th standard names of bones. There are some clavicle and scapula are parts of shoulder girdle. Humerus is the equivalent of femur, and radius alla is equivalent of tibia fibula, and then there are joints in the hand. You just have to understand. There is a muscle which starts from clavicle and goes to humerus. What are the joints that it crosses? Establish a body continuity from clavicle to humerus. Clavicle to scapula, scapula to humerus. So it has crossed two joints. Ribs to scapula. Whether it's in the front or back, ribs to scapula, you have to reach from ribs to scapula, ribs to sternum, sternum to clavicle, clavicle to scapula. Three joints. Cervical vertebral column to scapula. Now, cervical vertebral column and scapula are pretty close to each other, but there is no direct bony continuity. Cervical vertebral column, intercervical joints, cervicothoracic joints, interthoracic joints, joints between thorax and thoracic vertebrae and the ribs, costovertebral joints, and ribs with sternum, sternum with clavicle, clavicle with scapula. Although they are so close to each other, they have crossed a multitude of joints. Thoracic vertebral column to ribs. Same like cervical, but one less. Here, thoracic vertebral column, ribs, sternum, clavicle, scapula. Humerus to alla. Elbow joint is functionally humero-ulnar joint. So it has humerus to alla has crossed only the elbow joint. Whereas radius, although structurally a part of elbow, humero-radial is not considered as functional elbow joint. So there are muscles that are going from humerus to radius, humerus to alla, elbow joint, alla to radius, radioulnar joints. Don't think of superior, inferior radioulnar joint. Radioulnar is one. There is a muscle which starts from lower limb and gets attached to upper limb. Starts from the iliac crest and goes to the humerus. Look at the amount of joints that it crosses. Hip bone, iliac crest, hip bone to sacrum, sacroiliac joint, sacrum to lumbar, lumbosacral joints, interlumbar joints, thoracolumbar joints, interthoracic joints, ribs with thoracic vertebrae, the costovertebral joints, ribs, sternum, clavicle, scapula, humerus. This muscle has crossed a wide number of events. All these are, there are real examples of muscles. I'm not just imaginarily saying some muscle which does not exist. Some joints cross multiple. So this is the meaning of the word crossing the joint. Second concept, strength of a muscle is directly proportional to the cross-sectional area. So you can see, this is an example of biceps, say, for example. Take the transverse section of this muscle at its widest part. That will tell us about the strength of this muscle. And take a muscle which is slightly slender than it, a bipinnate muscle. The cross-sectional area at its widest part of the bipinnate muscle and the parallel muscle shown on the left side are nearly similar. So why does pinnate increase the strength? Here you have to take the vector analysis. Every single fiber of a muscle is an independent vector. So whereas the number of parallel fibers are limited, which you can see, number of pinnate fibers are enormous. Take all the vectors of the individual fibers, bring it into one plane. All the fibers of the pinnate muscle reach in one plane. Then you take a cross-sectional area, it is quite more than the muscle of similar thickness, but when it comes to parallel fibers. So bring, like vectors have got a direction, vectors have got a magnitude. They don't have a starting point. So you can start vectors at whatever point you want. Bring all the vectors to one level and then take the cross section. But let us say, pinnate muscles, they act obliquely, whereas parallel muscles act in the same direction of movement. So, do they lose their potency? And if they lose, how much do they lose? Here, individual muscle fiber has to be resolved into, this is the pull of the muscle, which has been resolved into two vectors, one along the direction and one at right angles to the direction. And the one along the direction of that green line is the actual line of pull. The angle between the line of pull and the muscle fibers is a difference of around 30 degrees or less. So the component which is along the direction of the pull is cos 30. Cos 30 is 0.87 and lesser than 30, almost 0.90. So the pinnate muscles have lost only 10% of their potency. 90% is still along the line of pull. So it has not really lost its potency much. And because of that enormous cross-section area, it is much better than parallel muscle. They hold the same movement. Muscles act best when the line of pull is at right angles to the axis around which the movement takes place. This is the axis of movement. You have two muscles here, one pulling at right angles, that's the best action. One pulling at oblique, acute angle, its potency is lower. As it comes closer and closer to, let's consider the famous angle symbol used in geometry, theta. You try to resolve those oblique fiber into the vertical component, it will be sine theta. Which means sine theta is maximum if the angle theta is 90 degrees. Sin theta is 0 if the axis is parallel. Here we have an axis and there are three muscles, one parallel to the axis, which means the angle is 0, no roll. Oblique to the axis, sin theta roll. And right angles to the axis, west. Here we have three examples, all three pertaining to upper limb. There is a muscle called biceps brachii, muscle which bodybuilders show, front of the arm. It has got, because of the insertion of radius, it's a supinator of the radioulnar joint. It causes clockwise movement of the right upper limb. It causes tightening of screws. But axis of radioulnar rotation is vertical. Biceps is also vertical. So the role of biceps is 0 when it comes to supination if you keep your elbow extended. If you flex the elbow to 135 degrees, sin 135 degrees, whatever, 1 by root 2 or whatever, that it improves better than fully extended. Biceps acts best when the elbow is 90 degree flexed. This vector analysis is known to all carpenters. You don't have to tell them, flex your elbow by 90 degree, biceps will act best. So he knows the vector analysis. He already learnt it from childhood. The oblique line of pull is when it comes to pronator teres, starting from humerus, runs obliquely down to radius, and the right angles is pronator quadratus. Two muscles which help in pronation of the upper limb. They keep your palm downwards. The teres is obliquely running, the quadratus is at right angles. Pronator quadratus is a better pronator than teres. Sin theta. Every line of muscle pull can be resolved into three right angle vectors. So far we were talking in 2 dimensions. When it comes to 3rd dimension, there is a muscle pull which can be resolved into a vector at right angles to the mobile bone, parallel to mobile bone, and tangential to mobile bone. These are called as spin component for tangential to the mobile bone, swing component right angles to mobile bone, and shunt component which is along the long axis of the mobile bone. Shunt component is meant for stabilizing. Swing component is required for changing the angle at the joint, and spin components for rotation of the. So all muscles have got differing degrees of spin, swing, and shunt. If a muscle has got more shunt component, it is called as a shunt muscle. More spin component is called spin muscle. More swing component can be called as either swing muscle or spurt muscle. Last concept, line of muscle pull and axis of movement should be skewed. This is a pure geometry term. We can understand simply by non-parallel, non-intersecting. So when it comes to the movement, let's say transverse axis is around which the movement of flexion and extension takes place. If the muscle crosses a joint anteriorly, it will be a flexor. If it crosses posteriorly, it will be an extensor. If it cuts the axis, it will be neither flexor nor extensor. That's why rectus femoris, tensor fasciae lata, sartorius, all of which are crossing in front of the hip, they are flexors. Gluteus maximus, hamstrings, cross behind the hip, they are extensors. Gluteus medius and minimus, they intersect the transverse axis. They neither flex nor extend. The other movement is, let's say, anteroposterior axis. The movement are outward or inward, called as abduction or adduction. If the muscle crosses a joint superiorly or laterally, it will be an abductor. If it crosses the joint inferiorly or medially, then it's an adductor. Here, sartorius crosses superiorly and anteriorly. So, it should be, by logic, it should be an adductor. It's actually an abductor. Because this is the only muscle which actually runs from lateral to medial. Most of the muscles will run from medial to lateral, in which case they'll bring about adduction. And because this muscle is running lateral to medial, it has got an action 90 degree right angles to whatever is its expected action. So it's an abductor. And the third is along the axis of the mobile bone, vertical axis, the movement of rotation takes place. A muscle acting from front of the axis is a medial rotator. A muscle acts from behind the axis is a lateral rotator. Sartorius again becomes an exception because it's running from lateral to medial. But otherwise, remember, iliopsoas, adductor longus are both crossing in front of the hip joint. Because they are crossing in front of the hip joint, they cause medial rotation. The moment there is a fracture of neck or femur, the axis shifts. Now hip joint is no longer the axis, femoral shaft becomes the axis. So same muscles, adductor longus and iliopsoas, because their insertion is behind the shaft, it becomes a lateral rotator. So there is a shift towards lateral rotation. So if you find an elderly osteoporotic female who is fractured and is lying in the orthopedic ward, one of the toe is pointing upwards, one of the toe is pointing outwards. So you know that the outward pointing toe is the one which is fractured. If you go and ask her, what happened? She'll know you're a novice, you don't know anything, she'll not tell you anything. To establish a rapport, you must act that you are more learned. So that you should say, oh, what happened? When did you slip in the bathroom and fracture your right lower limb? It's not even read my case paper and it knows this much. Slipping in the bathroom is the time when strong adductive forces try to prevent you from slipping in the bathroom. And that's what causes the fracture. And then suddenly when there's a fracture, shift of original medial rotators become lateral rotators. Moral of the story, while you're sleeping in the bathroom, slip and fall. The femur is sufficiently cushioned by muscle that you will not get a fracture femur. But then head injuries and other parts of the body injury, you can't guarantee. With that, we come to the end of our discussion. You can likewise work for every muscle, whether it crosses or not, and secondly, crosses from which part of the axis around which the movement takes place. So what are the concepts that we discussed? Muscles act at joints only if they cross them. Strength of a muscle is directly proportional to the cross-sectional area of the muscle. Pinate muscles, do they really lose their potency because of the oblique line of pull? Muscles act best. The line of pull is at right angles. So when you're talking about in terms of which is the better muscle, find out which is at right angles to it. Line of muscle pull and axis of movement should be skew or intersecting, not parallel. If you have any comments or questions, you can either directly mail it to me or you can ask now right away. Thank you.